This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
Hey everybody, it's Monica Robbins coming to you from the WKYC newsroom. I apologize for the audio. I'm using a webcam today. So today is the day that the Pfizer vaccine received full FDA approval, and I wanted to know what that really meant to those on the front lines. So I had a chat with Dr. Joseph Khabbaza, who's a pulmonologist at Cleveland Clinic, about what he's seen in the last 18 months and what full vaccine approval really means to him.
Been asked about this a couple of times. I think a lot of us have been immersed in taking care of COVID patients, especially in the ICU and in the hospital. We haven't really thought about authorization status of the vaccine. All I know is in December, we were all tripping over each other to try to get vaccinated. And once we got our shots, that was a very therapeutic and big turning point, I think, for a lot of us mentally. Just being able to take the fear and concern that we'd have of catching COVID ourselves. And then gradually you start seeing the numbers drop drastically in the hospital. You see so much less pain, death, and suffering. So excited about the vaccine. But then, over the last couple of months, as you start talking to patients in the office who may be hesitant about getting vaccines, and you hear some stories or reasons from patients, and listing one of them of just having emergency use authorization. It's nothing we ever even realized could be a potential thing holding back people. So learning about that a couple months ago, made me hopeful that once there was official authorization, that at least for those people where that was the main holdup for them, that would give them the added confidence to go get it. So it could, how many people will get vaccinated as a result of this who are only holding on to that piece? I don't know. But if it's more than one person, I think it's a very positive thing, because what we've really known for sure, nothing has minimized the pain, suffering, grieving, and death like vaccines have. So it's a very hopeful time.
You and I talked in the very beginning of this pandemic. Since that time, what have you seen? How has it changed your perspective on what this pandemic actually means to people as somebody who works in an ICU?
Yeah, it's been very humbling. I will say, so I'm also an outpatient lung doctor where I take care of healthier outpatients for years, and then I work in the ICU 1 or 2 weeks a month. And from March, when I met you, until January, I lost 6 outpatients to COVID. So 6 people that I've known for years who died as a result of COVID. So any loss really hits close to home. And of the dozens and dozens of people I never knew who I took care of who have passed, those are tough too. But the personal element, it really hit me harder than I expected to see that volume of patients. I don't lose 6 patients a year to lung cancer or fibrosis or COPD. So having that all happen in a shorter period of time while just seeing tons of other loss of life and suffering, it's a wake-up call. I mean, as an ICU doctor, I'm around a lot of end of life, a lot of difficult situations, but nothing really prepares you for the volume of loss of life and suffering that you see. And I think also early on, having an appreciation to how much of an added medicine it is to have family at the bedside, to take care of sick, scared and dying people without a loved one holding their hand or talking to them daily. That is really tough. And studies have showed that further, how that's kind of affected patients during COVID, not having family around. And so that gave a whole new perspective. And I really pride myself. I form a lot of close family relationships and rapport in the ICU, especially, and being able to know the loved one who I'm speaking to on the phone, to not even know what they look like or lock eyes with them while having some very difficult conversations. That will put a little bit of an extra strain emotionally on us as well. And that's a lot, through that first half. Now, we saw a lot less young people in the ICU in the first half of the pandemic. But whenever I see a young person in their 20s or 30s on a ventilator with young kids, pre-vaccine, when I'd go home, I'd lay in bed at night wondering, am I going to be next? Are my kids going to have to hear about me being on a ventilator one day or just being in the hospital? since vaccines, that thought doesn't cross my mind at all, because I know I'm just so well protected. They've been so amazing, these vaccines, at keeping people from getting very sick. And which has made these last couple of months, it's been tough because we're seeing a lot younger, healthier looking people than we did at any point during the pandemic. And is that due to Delta, or is it due to kind of less things in place that prevent young people from being exposed to high amounts of virus? Or whatever it may be, but we're seeing a lot of younger, healthier people than ever before on ventilators now, or on high flows of oxygen in the intensive care unit. And it's really, each wave of this pandemic has had its own unique stories and challenges and really heartache. And I don't, and they've all been unvaccinated. When you see a young, healthy person right now on the ventilator, I think the preventable nature of this pain and suffering kind of makes it harder to see, because it's always hard to see human suffering, even if they may have chosen a path that increased the risks of that. But it's never easy seeing just a fellow human being struggling or not surviving. But because of vaccines, I think all of us who work in the ICU can be more focused on the patients and their families and what they're going through. And thankfully, more families allowed at bedside now. But I think the fact that we've been able to take the fears of us or our families ending up in those beds have been very helpful. But certainly, I think with today's news, if it increases the odds even slightly of more people developing strong immunity to COVID the easy way, it's just going to minimize the suffering that we're seeing more and more of these last couple of weeks. And it does not appear we're near our peak yet, and things are just been slowly drifting up. And like throughout the pandemic, it's just a one day at a time approach. We don't know what's around the corner. We don't know what next variant's around the corner. And I think Delta is really that curveball that really threw off a lot of our stats and models, and really our hopes for a fully normal summer and fall and a relatively normal life moving forward. But it just shows the importance of having immunity to COVID. Any immunity you have is going to help in the future, whatever variant may come around the corner.
Talk to me about those patients that you've been treating. How many of them actually asked you, can you give me the vaccine now, when in your mind it was just too late?
Yeah, so Bernard, that question, I guess, did not come up when by the time they end up in the intensive care unit, they've usually seen a couple of providers already, whether it's the emergency doctors or their outpatient doctors or their hospitalists on the floor. So by the time they're very sick by me, I have not gotten that question, and many of them are probably too sick to be asking or thinking about it. If they've asked that question or wondering about it, it's probably already been answered. I did have one patient who was unvaccinated, who at the first sign of developing a flu-like illness, then became scared and then went out and got the first COVID vaccine at his first sign of symptoms. Unfortunately, it doesn't work that way, and he died 19 days later of COVID. And it just shows, I think there are a lot of people, and I think most of the unvaccinated people I talk to are really genuinely conflicted and not, they're open to it, but have not been swayed in the direction or really come across a healthcare provider or someone they trust to kind of have the discussions eye to eye. And I think this patient, he'll always stand out to me as somebody who, if one of us got to him earlier in the office or were able to encourage or answer questions, could he have been saved? Because he was willing to take the vaccine, but he took it after he first developed symptoms of COVID, and unfortunately passed 19 days later.
Are you seeing vaccinated people? Are you starting to see serious breakthrough cases? And if so, how many compared to the unvaccinated?
So we do see a couple of, especially with Delta. I think pre-Delta, it was almost unheard of to see a vaccinated patient in the ICU. We had a couple that would trickle into the hospital for a couple of days. And these were all patients who were immunocompromised. They were on medications that we know blunt the response to the vaccine. So it wasn't terribly surprising, but their illnesses were quite mild, and none of them did I meet in the ICU. So very, very few subset of patients would make it into the hospital even, let alone the ICU. These last month or so, we have been seeing more serious breakthrough episodes in people who are vaccinated. It's still far less, and I can't imagine it's anything more than 5% of what we're seeing in the ICU. I don't know, 5 to 10%. I mean, it's a really minimal number. I mean, I can remember each individual case, at least that's been in our ICU, and they've, again, mainly been patients who are immunocompromised on medications that the vaccine that has less of a response, then they're facing higher virus exposure from a more transmissible Delta variant, which just attaches to our airways so much easier than the prior strains. And then we've seen a couple of patients who are very elderly, so above 80 or 90, where we know the immune system gets a little bit weaker with time. All of these patients survived. One had to stay on the ventilator for a period of time, then was able to get off of it and move on. And as far as I know, they've gone out of our ICUs and onto their rehab and recovery. But the illnesses were likely far more mild than had they been unvaccinated. But it's still, I mean, I can't imagine. I mean, it's still well above 90% of severely ill people who are in the ICU with COVID are unvaccinated. And the vaccinated breakthroughs that are more severe have been mainly in that subset of patients that I think the ones where the booster was approved for, also people who are just immunocompromised with specific conditions and on specific medications that we know will blunt the immune response to a vaccine.
So what's your concern about as we go forward? Obviously, we're hoping that people look at the Pfizer vaccine a little differently now, and perhaps maybe FDA approval sways them. But we're heading into cold and flu season. Kids are going back to school. What are you most worried about based on what you're seeing?
I'd say that the capacity is always going to be my biggest concern, especially since we're not, I don't think, near our peak yet for this wave. I've been around the country giving talks and doing work in other states that have been a little bit more affected recently. When I get stories from other ICU doctors about their COVID experiences right now, it does get me a little bit nervous. You hear stories of a patient diagnosed with an early stage lung cancer that can be cured with surgical resection, but her surgery was canceled and pushed back because it's not considered emergent right now. So, you have a patient who has a curable cancer whose now surgery has to be put on hold until their local hospitals are doing non-emergent cases now because they don't have bed capacity in that state to take on any basic non-emergent surgical procedure. That's just kind of one example of stories I've heard from all over of just non-COVID related illness might take a hit. That's always my biggest fear. And a lot of these are people who are vaccinated, who kind of did the right things for their health, but are going to have their care potentially compromised if we don't have capacity to do a lot of non-COVID stuff. We're not there yet in Cleveland. I hope we're never there. But hearing stories from colleagues of mine in other states that are more affected right now, that's always going to be my biggest fear.
How are you dealing with the compassion care burnout? We've seen it among a number of doctors and nurses. How are you managing?
So I think exercise has been very important. I really have a huge priority on making sure I'm exercising daily or regular. I mean, most days of the week to get some kind of exercise in the morning. That's helped quite a bit. And I think just really going home and shutting out social media and news. I mean, I don't really follow much of that stuff or the outside noise. When I see, because that added on a bit of stress for me, I think early on, especially pre-vaccines, where patients would tell you a story or show you this or that, and that can get really challenging to try to explain basic science to people who are trying to educate me about something I've kind of trained my whole career for. And I think just trying to really avoid the noise. I think having vaccines is really probably was the most therapeutic thing mentally for me personally, I think for many of my colleagues, because now we just didn't have that. We knew, I'm protected, my family's protected, my friends are protected. And then that, if I can't, you can't really convince, oftentimes can't convince people to change their mind in some of these settings. And I just try to also just offer information and answer questions in the office non-judgmentally. We're not vaccine bullies. I just want to make sure I tell patients if they're going to be making a life or death decision, which I think choosing to not get vaccinated is for many people, that I want them to at least do it, based on the right facts and information. So I think avoiding a lot of that outside noise is helpful. And yeah, I think a lot of the last year has you appreciate the little things a bit more, and just going home and just watching my kids run around and cause havoc, and just really focusing on simpler things and realizing those are things that matter most in life. It's kind of the little things that we may not think about as often. So having a greater appreciation for things like that. But I will tell you, I mean, June is when I kind of hit a wall mental, where I almost felt that burnout. I mean, we just had a wave. I'd never seen a volume of deaths in 1 week in an ICU before, after a rough couple of months. And that's where I kind of stepped back and regrouped. I had a vacation, I had some time off that randomly was there. And, I think since then, I mean, the self-care is important, but exercise and focusing on family has been the main thing. And I know many of my colleagues, mindfulness meditation has been very valuable as well. Just taking a few minutes a day to sit down and focus on being in the present moment. This has been very humbling. We're not in as much control in medicine like we like to be and used to be, and especially in the ICU. So embracing and realizing it's just one day at a time. There's only so much we can do, and to not try to do everything at once, and not try to educate everyone at once, and just to be compassionate even with those who are not, who are getting information probably from the wrong places and making harmful decisions. Most of them are not bad people. I'll tell you, many of the unvaccinated people I've come across in the office and even in the hospital, where family meetings with an unvaccinated loved one who's dying, and meeting their family who are largely unvaccinated to talk about. I mean, these are some of the sweetest people I've met, and I think we're all kind of humans struggling through this pandemic one day at a time, but everyone's coming from a different place and just trying to be more compassionate really with people who have chosen this route, because many of them, I think, may not have had the right conversations before, and whatever led them down that path, which unfortunately too many has caused loss of life and illness.
If you had your soapbox and you could stand on it, what would you say to people after the last 18 months of your experience? What would you say to people now?
Really, I think the message stays the same that I've really said all along, that but it's an easy virus to avoid. So if you choose to have no immunity to COVID, which we did not have early on, you got to really be very vigilant, and especially with a very contagious, a lot more contagious strain now. Who knows what's around the corner? But it's, so the messages are similar, but really to everyone who's unvaccinated or does not have full immunity, I tell people also that I wouldn't wish even mild COVID on my worst enemy. So I want everyone to be as protected from this virus as possible, because nobody should suffer the way too many have. But we're all going to come across it one way or another, it seems like, because it does not seem to be going anywhere. And will the next strain be more contagious? I mean, who knows? So we're all going to, our immune system's all going to be exposed to some part of COVID. And we have the choice to either get immunity the easy way with the vaccine in our arm, like we have our whole lives with other vaccines, or to roll the dice and get immunity the harder way through natural infection, and not knowing what it may do to us, but also, spread it to others and potentially harm somebody we really care about, or even a stranger. But I think, unfortunately, we're all going to be facing it at some point. So get immunity the easy way is really the message I try to get across.
I'm glad you brought up natural infection. How many people are you seeing in the ICU who had COVID last year before vaccine, still chose not to get the vaccine because they thought they had natural protection, and then they got the Delta variant?
Yeah, I think the answer is too many. There's certainly a handful just right now in our ICUs, and some young people that had very mild disease last November, December, felt it wasn't needed to get vaccinated, although we've been recommending that after 90 days of a natural infection to get immunized. And then really this Delta variant has really been the big equalizer. I mean, it's what it's done to so many. It's really, it's still almost doesn't feel real what we've been seeing here. Natural immunity was probably pretty good against most non-Delta strains for probably longer than we suspected initially, but we still didn't know how to identify who were the ones who were going to be well protected for a long period of time or not. So that's why vaccines were recommended even in the face of natural immunity. But Delta has kind of changed everything in terms of the strength from natural immunity back then. And so even some of the data that trickles out, I mean, it does suggest natural immunity from a year ago is better than no immunity, but still probably not confidently sufficient to go through this Delta surge and whatever may be in the future.
So you would still tell those who had COVID a year ago, please get vaccinated?
Yeah, honestly, before Delta, people who were truly on the fence, who were infected last year or early this year, I told them, the fact that we do recommend getting vaccinated after 90 days. They may have protection far longer than 90 days, but we didn't know how to identify them. But they probably had, some degree of protection, but I couldn't tell them for how long or pick who they were that were going to be protected. So still recommended, but if they did not choose to get vaccinated, they probably would have done okay had they come across, but okay, I think in the middle of a pandemic isn't really confidence building. But now with Delta, my advice really has changes quite a bit, because what we're seeing is Delta doesn't seem to really be bothered too much by what you may have had in October or November of last year, or even earlier this year. And so I think natural immunity in the face of the Delta variant, it probably does a lot less than it did before. Still hard to quantify, but I've seen enough severely ill patients with the Delta variant now who were infected last year to know that I would not want to take my chances.
I would think FDA approval today is making your heart sing a little bit, if that means more people will get vaccinated.
Yeah, I hope so. I mean, even if it's hard to quantify how many, but it's certainly not a bad thing. And I can't imagine that some people won't be affected by this, who might have been teetering on the fence there. So even if just one person gets vaccinated after this, it's a good day. That's one less person that is going to suffer from COVID, one less family that has to grieve that suffering, and one less hospital bed that's being used as well. So vaccine. I do a lot of stuff, in the ICU especially, that might be considered life-saving, a lot of procedures. We do a lot of things we do in an emergent setting, but there's no greater feeling I've had really both in the office and in the hospital than when I talk to a patient who's on the fence who chooses to get vaccinated afterwards. That feels like really the most life-saving thing that we can do now. And so that's become the more rewarding part of my job now as a pulmonary and critical care physician, is really talking about COVID prevention and trying to help educate people on vaccines. And I get a little emotional when that happens. I mean, and I'm not a very emotional person, but if I talk long enough about things I've experienced and seen and stories from the last year and a half, I start tearing up, not even thinking about it. When I talk to patients who are on the fence about the vaccine and answer their questions, and then they say, you know what, all right, I'll go get it. You feel emotional. And so I think of all the spectrum of really, and I think many of us in medicine feel similar, where that is really, I think, the priority. That is how we can save lives and prevent really unnecessary pain and suffering and grieving and loss of life.
What will haunt you about this pandemic, and what will change you relating to your career as you move forward?
I think the most haunting parts will be, hearing people's last words before they end up on a ventilator and them dying afterwards. Like you're the one hearing the last words, and the volume of which we've had to see that. And because COVID slowly makes you very sick, many of these patients are sitting in the ICU for a couple days, coherent, just on a lot of oxygen before they end up on a ventilator. And some of those conversations and what's been very humbling also is that with COVID, you never know when the corner is turned, kind of like with other illnesses. I'd say my most haunting, at least if I just think of a flag, there are many, but the one I think about most of a younger patient in her 50s and who I thought was turning the corner. And but she was quite scared, understandably, but I felt confident the corner was being turned, and I reassured her and her family. And then a couple days after I went off service, she ended up on a ventilator and then passed within a week. And so that is something you think about, a lot, and it has humbled you because you don't know who's turning the corner. But it's just sad that one of the last conversations that I had with this lady was reassuring her, and I was hopeful and thought she was turning it, but but unfortunately, like too many did not survive. But to really, for me as an ICU doctor, to step back and just say, I don't know where this disease is taking you, but we're going to go 1 hour and 1 day at a time here, and until it's good. It takes a long time to know when that corner truly has been turned.
Dr. Khabbaza, thank you for all you do, and thank you for sharing your insight.
Anytime. It's good to, you're anything for you.
Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Subscribe and find video podcasts on my YouTube channel, Monica Robbins. Until next time, have a healthy week.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.